So the first slide, as always, is a disclaimer. The material presented today is generic. It is not meant to take the place of any formal instruction that you have from your healthcare providers. Okay? And our objectives are threefold. First of all, I want to present a brief overview of the lymphatic system and what are the risk factors. Secondly, I hope all of you leave here learning some strategies on risk reduction and self-management. And lastly, I want to present that overview of current self-management techniques. So first and foremost, what is your lymphatic system? In order to understand risk reduction strategies, you need to know a little bit about what this mysterious thing is. For many of you with a cancer diagnosis, this may have been the first time you've ever even heard of your lymph nodes. Your lymphatic system simply is a collection of both lymphatic vessels, or a network of vessels throughout your body connected with lymph nodes. And together they have two key functions. They help with fluid balance in your body, and they help fight infections in your body. You'll see on this schematic diagram, there's also some organs tucked in there. Things like your spleen and tonsils, things that we kind of know are associated with healing. They're all part of your lymphatic system. Okay? A couple things to note about this diagram. You see the vessels, they kind of go everywhere. And it's no coincidence, they seem to be in parallel where we think of our arteries and veins. That's no coincidence. Your lymphatic system is actually part of your circulation system. So when it helps with fluid balance, essentially any excess fluid that it may help filter out of the body, like excess lactic acid from exercise, or if you have swelling after an infection, it kind of brings everything down through the heart and through the circulation system. Okay? This is another sort of schematic diagram of the lymphatic system. And what I like about this slide is it kind of, again, delineates a lot of the vessels here. How many women in this room have not had their surgeries yet? Okay, so all of you, you've gone way past that thing. If you remember, after your surgeries, you were probably told, especially with a breast surgery, to not lift your arms over your head for a certain amount of time. And if you had abdominal surgery related to your ovarian cancer, you were told not to lift anything for a certain amount of weeks. Part of this is to let these delicate vessels, many of which are microscopic, to heal. If you go and you try to lift your arm overhead because you just want to prove that you had a lumpectomy and you can do this, it might be okay. You might actually be hurting some of these little vessels. So if you have friends who are still in this early stage, tell them to listen to their doctor, okay? A couple other things about this. You'll see there's a lot of lymph nodes and a lot of vessels here in the abdominal area. This is a critical area because most lymphatic fluid, especially stuff that's coming up from the legs, goes through here, comes up to the heart. So as a lymphedema therapist, we kind of think of this as Grand Central Station. Sounds kind of like a funny word, but how many of you have ever taken a yoga class or qigong and felt really rejuvenated after? Okay, that's because when you do deep diaphragmatic breathing, any of those things, that affects here, and that actually helps your lymphatic flow throughout your body. This is going to be some of the stuff when we talk about exercise for risk reduction. Okay. Last, as you'll see, there's a lot of lymph nodes everywhere. They're not just in your axilla, they're not just in your abdomen, they're everywhere. And it's estimated that the body has, on average, 300 to 600. In each axillary area, the average is about 25. So for those of you who might have had a sentinel node biopsy and are panicking, well, 2 to 3 lymph nodes is not 25. If you had 10 to 15 lymph nodes removed, you might have some worry. In the abdominal area, we're not sure exactly how many because they're interspersed throughout the various organs. But know that with ovarian cancer in general, when they're doing the surgery, they're looking primarily to, they call it sampling, which is kind of an odd word, but basically they're taking things from what they call the retroperitoneal area, or basically the back part of your abdomen behind the uterus, to basically see if the cancer has spread to any of those things. They're still leaving a lot of the other abdominal lymph nodes there. So it's not like when you have a lymphadenectomy that it's like a one and done. Okay. All right, functions of the lymphatic system. We've already mentioned them. Number one is to fight infections and injuries, heal from injuries, to filter out waste products from the body, and closely allied with this is to maintain normal fluid levels in the body. So what does this look like? Well, everyday stressors that we've probably all experienced. If any of you have ever had a bad sunburn where you kind of got a little swollen, that's an area where your lymphatic system is overloaded. If you've ever sprained your ankle and it kind of blew up like a balloon, that's a temporary situation. Or if you've had an infection, and it could be something like even just something on your nail and your finger swells up, your lymphatic system sends white blood cells. It helps those areas out. Okay? So your lymphatic system at work. Another common example is when you exercise vigorously. Let's say that you went for a long hike. Has anyone here ever had their feet and ankles swollen after? Okay. Or you've done a heavy workout, your hands are a little bit swollen, or maybe after you've gardened for a day. So those are areas where the lymphatic load is temporarily high, but your lymphatic system says, we got this. Everything's intact. It works to get rid of those things, and usually within a few hours, those types of swelling are gone. You run a marathon or a 10K, you get rid of lactic acid usually within a few hours of the end of your run. So those are, again, those are examples of your lymphatic system working normally. Oh, and then I know I saw I put the insect bite. I had to put that gross one up, but we'll come back to that one. So what is lymphedema? In its simplest explanation, it is a buildup of fluid just underneath the skin in the subcutaneous tissues. Okay, that's a fancy way of saying between your muscles and the skin, and it occurs when your lymphatic load is greater than what your lymphatic capacity is. So what makes it different is that if you have a sprained ankle, your lymphatic capacity is still pretty good, so that temporary overload gets distributed. If you have a bad sunburn on your back and your arms get a little puffy here, your lymphatic system within a day or two, depending on how badly you got burnt, will kind of take care of that swelling. With lymphedema, it might be that your lymphatic capacity, at least in an affected arm or an affected leg, is no longer that good. So that, let's say you're a runner and you go back to running after when you're done your cancer treatment and have any kind of energy left, because right now many of you are probably thinking no, it's like, oh, this leg is like, it's like swelling after 1 mile. That's weird. So that's where lymphedema comes in. We're specifically concerned today with what we call type 2 or acquired lymphedema. That simply means lymphedema that is acquired because of surgery, radiation, trauma to tissues, infection, anything that can damage normal healthy tissues. And in this country, we usually see it after cancer or during cancer treatment. Okay? The other type of lymphedema, I'll just mention briefly, is called type 1, and it's congenital, meaning you're born with it. So people are either born with an already puffy arm or leg, or they may develop it at puberty, or even there's a type called lymphedema tarda that occurs when they're 35 or 40. Why do I mention these? Because if any of you, actually I should just ask, which of you have gone online to look up lymphedema? Okay, how many of you think those pictures are really freaking scary? Those are mostly type 1. And I could always tell if someone came into my office and I was working, it's like, you went online, didn't you? You saw those Wikipedias, like especially the gigantic legs. So it is scary, but those are not you. And that's what I always tell people. It's like, and especially in today's world, the kind of lymphedema that we see is, again, for the most part, it's not going to be the severe types that we might have seen even like 20 or 30 years ago. I was certified in 2013, but I initially went through some lymphedema training in 2001. And for a variety of reasons, I never was able, I just worked for a few months and then my life changed, and so I didn't actually go back to it until much later. But in 2001, that's when we're still seeing women after radical mastectomies. They were having total axillary node dissections, I'm not even going to, an ovarian cancer was still a death sentence pretty much in 2001. So it was a very different environment, and the types of lymphedema we saw were more severe. In my 10 years of working, I probably saw only 2 or 3 people in the very severe type of lymphedema, breast cancer related, unless they were people who had had it 30 years before and got a recurrence when they were like 20 or 30 years later. Okay, so I just want to put that out as a reassurance. Breast cancer and ovarian cancer related lymphedema, couple things that are to note about them. For breast cancer, it's not just in the arm and hand. It can be solely in the trunk area. So if some of you have felt like you have a golf ball sticking out of your side, or even just like in the scapular area, that's still lymphedema. It doesn't always have to look one way. In ovarian cancer related lymphedema, if you read up, it'll say, you might get it in your legs. What I saw more clinically is sometimes it was in people's legs, but a lot of times it was actually in the torso. It might have been in the suprapubic area, the genital area, the thigh area. And I had to ask people because these were things they might not even have brought up to their physician. If you had a lot of swelling after your ovarian cancer surgery or hysterectomy, and you're feeling bad about a lot of things in general, the last thing you want to bring up to your doctor is that you've got genital swelling. That's weird, okay? But these things are very real, and there are ways to kind of deal with it. Okay, the risk if you only have a lumpectomy and a couple lymph nodes removed, pretty light. But the risk varies tremendously if you've had a lymphadenectomy, from 30 to 60% with women with breast cancer. And then in ovarian cancer, they think the overall risk is 15 to 25%. I want to talk a little bit about those stats because they seem like they're pretty varied. So how many of you saw the last presentation by Dr. Amindi? Okay, so I liked how she presented where sometimes when you're looking at data, you have to look at the endpoints. So a lot of lymphedema studies, when they look at the prevalence, they might be only checking people out 3 months after, when people still might have postoperative swelling. They might be looking 6 months out. It might be a 20-year study. Okay, with ovarian cancer, if they're only asking them if they had leg symptoms, they are totally missing the people who might only have swelling in the abdominal area or the suprapubic area. Okay, so I think that sometimes things get missed, or they might still be like almost reporting things too early. And that's why when you look up stats, it's going to be all over the place. It's not that people got it wrong, but different people measure things differently. Predictors, as expected in both types of, and actually all cancer related things, number of lymph nodes removed, the extent of your surgery, radiation, and for women with breast cancer, especially if you've had supraclavicular radiation, which is the radiation above your collarbone, obesity, and adjuvant chemotherapy. Adjuvant's a fancy word meaning cancer after your surgery. I'm sorry, chemotherapy after your surgery. Yeah. Okay, because some people have had it before, and then some of you have the unfortunately, my apologies, it's like some of you have to have it both before and after. Okay, with the chemotherapy, it was especially noted with the taxane-based chemotherapies. For those things, you can't do a whole lot about because they're directly related to your cancer treatment. Don't despair because there are still risk reduction strategies, and it's not all related around obesity. So there is more to this talk, otherwise we'd be stopping right here. Okay, so first, let's talk about symptoms. In my practice, because I was working within the oncology team, I was fortunate to see people if they were suspected of having lymphedema. If they were at risk, high risk, I was sent, the surgeons would send them to me. So most of the people that I saw were in what we call a stage 0 to stage 1 aspect. And the main symptom was a sensation of fullness or heaviness. Some people may have had swelling, but some people just weren't really sure. And so, but that's probably the number one symptom. And it could be very subtle. Okay? Number 2, 3, and 4, the thickening and dryness of the skin, discoloration, discomfort and achiness, those are things that occur more if someone has a later stage lymphedema. Some people think lymphedema hurts. It may not, but it may be feeling like more of a discomfort or achiness. To me, the most critical thing up here is that number 5. That's the silent symptom, lowered immunity to infection in the affected limb. And that's where we're going to see a lot of the risk reduction strategies come into play. Okay? Okay. I want to make a note here that all swelling is not lymphedema. Okay. Is anyone here within still 3 months of their surgery? A couple of you. Okay. So it is important to really understand this, whether it's for yourself or even if you have friends going through this. Because how many of you have already had friends come up to you or colleagues saying, I just went through this, or I just got diagnosed? And it's like, you're in an age bracket where 1 in 8 of us will get breast cancer, and I don't know what the stats are for ovarian, but it's there. Okay, so if you're with a room full of former colleagues, you might have 1 or 2 people that you don't even know, were not even aware that have already been through this journey. And one of the most common fears that I got when I was working was, I'm going to wake up. I had my friends, they like, am I going to wake up with my arm looking like the Michelin tire man? Mm-hmm. No. Even my roommate at the time, it was like, really? You're still asking me this stuff? So it's important to know that swelling could be related to postoperative swelling, but normal postoperative swelling can be 4 to 6 weeks out. More if you've had extensive abdominal resection because of ovarian cancer. And then some of the reconstructive procedures for breast cancer involve a lot of work down here. So you can stay swollen. Seromas, I'll come back to infection, are things specifically with breast cancer where it's like a small nodule of swelling. And if I have people show up with those, I sent them back to their surgeon because they typically had to be trained. It didn't mean they had lymphedema. It just means there was still like some blockages and things going on. And it wasn't something that we had a specific treatment for. And then infections is something that, again, in the postoperative stage for probably the first 4 to 6 weeks, that can cause issues. Later on, if someone develops lymphedema, it is something that is also, it's important to recognize the signs of infection because that can increase your swelling. An infection in an affected limb can also trigger your lymphedema that you might have gotten, or it might have stayed silent for many years. Okay? How many people here know the signs of infection? Okay, since you're all not raising your hand, does anyone want to shout out any? Redness. Number 1, yeah, redness. Temperature. Yeah. Temperature. You might have a fever if you're someone who really ignores things for a long time. Red streaky things. Pain. Infections hurt. See how I got a sandal on this foot? So I called Sonia yesterday from the ER, and I'm like, I might need a stool because I have a stupid infected toe, okay? And it hurt so much that I actually went to a doctor, which is not something that I enjoy doing. And so I'm sure she thought, so she's on her way here to set things up, and I'm in the ER and going, I might need a stool tomorrow because I'm not sure if I can stand it, because at the time I really couldn't. I was like not happy. But then the doctor came in, did what they call an IND, which means they take a little scalpel, go, and it feels better. And I still probably have to have a little toe surgery. But basically, infections hurt like hell. If you have one, go to the ER, get on antibiotics, don't screw around. Okay. What lymphedema looks like and doesn't look like. So in stage 1 picture, which most of the people I saw is stage 0-1, can you tell which arm is affected? How many say right? How many say left? Okay. I'm not sure, but I think it's the left, only because it's really hard to tell, right? The person may have a little bit more swelling here, and their left upper arm might be a tad more. So, and there's even a stage that's not on here called stage 0, which is called subclinical lymphedema. So this we kind of classify people. If I have someone who's got 10 or 15 lymph nodes removed, okay, in the axillary area, they might go for years until like something happens, or they might never get lymphedema at all, or they might not get lymphedema for several years until something happens, like an infection, which we're going to get to in a slide or two. But basically, it means that the arm is still, it can't fight infections as much, but you have enough lymph nodes left, enough good circulation that your lymphatic load does not exceed your lymphatic capacity. It's a balance, okay? And so if I saw people at stage 0-1, I want to keep you there. And I apologize again for the women with ovarian cancer in the room. I found only one slide with for ovarian cancer lymphedema, and you know what? It was like a scary slide. I never even saw anyone like that. I'm not going there with you guys. Okay. So how can I help myself? Number one, skincare, okay? Anything that you can do. When we talked about, think back, okay? Things that create swelling, getting burnt, getting scraped up, doing things that cause swelling. If you can take steps to avoid how those things happen to you, that can be helpful. So we tell people, use sunscreen. A lot of these are common sense things, but especially like a lot of us, we pay no attention. I don't always remember to wear sunscreen. I do now since I've been an oncology physical therapist, but when I was younger, I did not pay attention to this stuff, okay? Take care of small cuts, scrapes. And this goes for, and this is where it's going to vary for each person. So how many of you, when you've been cooking or baking and you're in a hurry, the beeper goes off, you grab a towel, you stick your arm in the oven, and then you pull it out, and I got a little burnt here. Let me just put an ice cube on it. Does anyone have, yeah. Okay, I'm seeing a lot of nodding heads. I've done it, not anymore. Use an oven mitt. If you have pets, oh look at Fluffy. Fluffy's like going like this on my leg. That is not a good thing if you've had ovarian cancer and you had lymph nodes taken out here. If you have a cat that likes to lay on your arm and occasionally bite you, no. So it's starting to look at these things in your individual thing. For me, I've never had cancer, but what I would have to look out for is walking barefoot in my yard, or I like to go pick lemons from my lemon tree, which has thorns this sharp, this big, and they hurt. So things that are pokey, anything like that is an infection risk, okay? Because it's dirty. So yes. Oh, and if you like to, using bug spray. A lot of people don't like to do bug spray because it might have chemicals in it. Here's the deal. If you do outdoor stuff, if you go fishing, hunting, whatever, and you're around with these mosquitoes, find a safe bug spray you can leave with. It's better than getting bit by a lot of things that have like little pointy stuff that carries like germs, okay? All right. Weight management. A lot of you look like you're still in treatment or recently finished treatment. So we're not recommending that you go on a diet. But if you have concerns about this, talk to your cancer team, because many cancer teams include a nutritionist or a dietitian on their staff, and they can kind of help you with if you needed to lose a few pounds afterwards, okay? Many of you, actually, those of you, it's like, we've just had to talk about hormone stuff. It's normal. A lot of people gain weight after some of these surgeries and things because your hormones drop. And the reality is that postmenopausal, we all put on a little bit weight unless we try harder. So it's kind of like, but get some advice from your team. Exercising can help. So any exercise that uses deep diaphragmatic breathing is a good thing to do. So anything that promotes deep diaphragmatic breathing is good. All right, manual lymphatic drainage. Next, we'll talk a little bit more about this when we come to self-management, but basically it should be gentle and flowing. So a few more things, but risk reduction, what's really important. Through these slides, the next few slides are covering things that answer the questions that I got the most frequently. So one of them was about plane travel. And in the old days, when people had radical mastectomies, plane travel without compression sleeve on was not a good idea because there was no protection. But now, there's been recent studies where they've looked at women who've traveled after breast cancer, and plain travel in and of itself will not cause lymphedema. Now, if you have lymphedema or you're at a high risk, which for many of us who are lymphedema therapists are like 10 lymph nodes or more removed, it's probably a good idea to wear a compression sleeve and glove. If you've had ovarian cancer treatment and you notice any swelling in this area, you might want to wear compression stockings. And especially on plane travel, wear a glove. Don't just do the sleeve, because what do you think will happen if you have a sleeve with nothing down here? Okay. Another question I got asked a lot was about weight training. Again, numerous studies have shown that weight training, especially if it's done in a gradual fashion, it does not cause lymphedema, but it actually, when they looked at control groups of a sedentary group and people who lifted weights, the control group, the sedentary group, had a high incidence of lymphedema. And then when they also had two separate groups of people with lymphedema, one sedentary, one lifting weights, the people with lymphedema wore compression when they lifted weights. They had less complications and less flare-ups than the sedentary group. With strenuous exercise, again, nothing has been shown. There's no data to indicate it does happen. However, if you're someone who's going back to play tennis or golf, and you notice your arm's swelling a little bit, or you get some swelling in your legs, wear compression. It's not complicated. You need to be honest with yourself that, oh, maybe I have that stage 0-1 where I might only get some swelling, like if I'm super exercising. Don't stop exercising, wear compression. Okay. The other concern, this slide might be a little confusing. I hope it doesn't show up as confusing when this gets put on the slide deck afterwards. But avoiding needle sticks and IV catheters is always considered a precaution. What I will say is that the original data on this came from studies back in 1921 by Hallstatt himself, the surgeon who invented the radical mastectomy. We don't know what sterile technique was back there. We know that they did really aggressive surgery. More recent studies have been equivocal on whether this is truly something to avoid. For myself, since I know that pokey things are not good, I'm actually really happy to keep on saying, yes, avoid someone putting an IV, taking an IV in that hand. Don't get blood drawn on that hand. But let's say that you're someone who you had an axillary node dissection here, but just a sentinel node here. Now you're thinking, well, do I have to take blood draws from my feet? No. This arm is probably fine. 2 lymph nodes out of 25, not an issue. If you forget 3 years from now and you get a flu shot on the affected arm, you're not going to get lymphedema. There's actually been some studies that looked at the whole acupuncture question, because I get asked about that a lot. For a lot of people want to do holistic things. And there's now been some retrospective studies that show that acupuncture is safe. So these are things where they took some blanket information from 100 years ago and they generalized it to a lot of things, and it's like there's some wiggle room there. Hand surgery on the same side, same thing. I would get asked from people who, some of my lymphedema clients would write back after a few years, hey, I got to have carpal tunnel surgery. It turns out there's not one, but actually 2 or 3 studies of hand surgeons, and there's very little evidence that hand surgery on the affected arm will cause lymphedema. Because the concern there is they have to put a tourniquet, like a temporary tourniquet when they do the surgery. It does not seem to affect it. You may ask why not? Sterile surgery. It's quick. And then the swelling that might be in your hand from having the carpal tunnel goes down. So it's all about lymphatic load and balance. Okay. If you do get lymphedema, this part will be quick. The lymphedema treatment focuses on reducing the swelling. If you know you have lymphedema or you're pretty sure, then basically be advised, seek out help from a certified lymphedema therapist. The phases of treatment, you'll notice that 3 of them are exactly the same as your risk reduction strategies. The only thing that changes is compression. So if you have lymphedema, you might need to wear compression when you run, when you do your more active sports. At the end of this presentation, I will have a couple of handouts through QR codes, and they will have some of the resources. And we are almost done, so I'm paying attention to that thing there. I threw a slide up here. Compression is something that when I spoke with people in the clinic, I would take one, sometimes two 45-minute sessions. There are hundreds of compression options. I threw some pictures here of some of the things that might not be as well known. So you've got torso compression for women who might have just more swelling here. You have compression camisoles. You've got compression more trunk garments. You have compression capris. Those funny little like padded things are called swell spots. So for people who might just have swelling specifically here or maybe here or here, you can wear those things within maybe some compression garments to kind of help with lymphatic flow in those specific areas. These resources are all included in the handout. On the handout, I will not include the more general things here. Okay. So this is the last slide. I've created, again, these two handouts. One is on some different compression resources as well as some general information on what to look for in compression. And one of them includes some of the tips on risk reduction strategies.
You had mentioned that acupuncture is okay. How soon after lymph node removal could you engage in acupuncture?
I don't know. So the question was, how soon after a lymph node dissection could you engage in acupuncture? And the data just was looking at whether it was a thing, but I'll be honest, it's been a while since I've read the study, so I don't know whether they were looking at people like a year out or 2 years out. As a lymphedema therapist, I would probably wait like 3 months. And then if you've had radiation, I might wait until about 6 weeks after your radiation is done. The reason being is that radiation also may increase localized swelling in this area. But you want to it's like, I'm ultimately a cautious person. So even though I know that it might be fine later on down the road, I want to make sure that you're not in a window of time in which you could get an infection, because that is, to me, I've seen lymphedema triggered more by infections than anything else. I have seen lymphedema triggered by bee stings, visiting Hawaii and getting cut on the lava rock, dog bites, things like that. Yes?
So I've got two questions. How do you feel about using KT tape as part of it?
It's interesting. So part of our training, or part of the current training actually uses, so she's asking about kinesio tape, that brightly colored tape. And actually in the more recent lymphedema certification courses, they actually teach people how to do that. And I'm actually a certified K-tape person. I actually had somebody once who I think that she triggered an infection from wearing her KT tape on too long. However, so here's the deal. With her, she just left it on for a week. Ooh, okay? So, okay, on the other hand, I have used like KT tape. I've had people who've had like localized abdominal swelling, and I've created KT tape things here for them to kind of drain back up into the lymph nodes in their armpit. So for the most part, I think it's okay, but my caution to everyone is, same thing, it's all about infection. Don't leave the tape on for like days at a time. That is gross. You need to be clean. Okay? I'm just, sorry, I'm being really blunt about this stuff, okay? All right. And you said, okay, two questions.
The second question is, so I had axillary dissection, and what are your thoughts on rotator cuff surgery? The surgeon explained that when they do the surgery, they're basically infusing water into the surgery site, and so post-operatively there's a large excess of water. So sort of clearing that out and sort of the risk between having that surgery versus spiking.
Yeah. So the question was, what about rotator cuff surgery? Do you have lymphedema?
Tiny bit, but not a lot.
Okay. So what I would probably do in your case is have your your shoulder guy talk to, if you have a lymphedema therapist, talk to them, or your breast cancer surgeon. You probably have some lymph nodes left, because most of the time they still allow that here. But probably the person who's going to be most important is that you might have some temporary increase in swelling because they do pump a lot of fluid in with a lot of orthopedic surgeries. So, but it's probably also like with the hand surgeons, you can have, if you have treatments to help dispel that, and it should be okay. There was a question over here.
I wanted to ask, because I'm not familiar with how to use K-tape. Can you just change it every 24 hours?
I would change it every 24 hours. Can I, two more quick questions?
Yes, kind of quick. I had breast cancer, but I have lymphedema in my legs, and it came partly from venous insufficiency.
Okay.
So yeah.
Talk to me after, because that's another, yeah. And I can talk to you more. Okay?
Glucose monitors. I had 16 lymph nodes taken out on this side. Can I alternate with the glucose monitor?
I have not heard that. I've not had that question before because they didn't exist when I retired. Maybe keep it on this side, but if you forget once in a while, or talk to your diabetic guy and see if you can put them someplace else.
Okay, last question maybe?
Last question?
Just a quick question. If I don't have swelling, do I have to wear the compression sleeve if I go to on a plane?
If you don't have swelling?
I don't have swelling. I have lymphatic dissection. Do I need to wear the compression sleeve if I?
It's up to you. So we recommend that if you had like 10 or more lymph nodes, you might want to try it out. I've also had women who've just forgotten their sleeve and nothing has happened. The worst that's going to happen is you go on the plane, you get a swelling, you come back and go, oh, I got to get a sleeve. It doesn't mean, it's no longer, it's like we don't panic anymore. It just means that you might have to address something that was kind of in that stage 0-1 phase. And if you aren't sure, get a sleeve and glove.
The drain on the after surgery of your breast cancer mastectomy, is that lymph node or
No.
lymph fluid?
That's actually all the stuff. Yeah, it's not necessarily in fluid. It could be like blood or other kinds of things.
Oh,
Yeah.
okay.
Yep. All right. I think we have to empty out the room. I will be outside a little bit so we can empty out things. But thank you very much for your attention.